This is a 31-year-old who's had pain for the last month or so. She initially had back pain and then started having severe left leg pain. For the last 2 weeks, she's had left leg numbness and weakness as well. She's developed a significant gastrocsoleus weakness, and the imaging studies would tell you the reason for this. She has a L5-S1 herniated disc. So these are T2 weighted sagittal images on the MRI. You can see that this is her tailbone here. This is 5, 4, 3, 2, 1. I just numbered the bone levels. In between the bone are the discs. And you can see at her age, these discs are what you expect, which are nicely hydrated. Anything that has water in it on this particular format on the MRI shows up white. So, for example, this column of white here is spinal fluid. Okay, and so the disc being white, you know that they're hydrated. Which, in contrast to this, you can see that this L5-S1, the very bottom disc here, is dried out. It's a little desiccated. And not only that, it bulges backwards toward the area of the nerves. Here's another, another window, another cut on the image that's slightly more central. You can see here's her spinal cord coming down. It's floating right in the spinal canal. And if you look at a relatively normal disc, the discs do not protrude into the spinal canal. But in comparison down here, you can see that there's a lot of disc material that's compressing and narrowing the spinal canal right here. You can see after the disc protrusion here, the spinal canal again opens up a little bit. So it's open, open, open here until you get to where the disc herniation here, and it closes down and opens up again. And again, here's just a slightly more to the left of central, to the left of middle. You can see again this extruded disc fragment. Now, if you take this tube of spinal fluid that we were just looking at, okay, and turn it so you're looking down the really down the pipe, so to speak. These are the images that you get. And the spinal fluid that we were just looking through is now turned, and so you could look straight down the tube of spinal fluid, and that's indicated by this round circle here. You can see again anything white on this is fluid, and that's all the spinal fluid. You can see that little dots within this tube are the nerves, and you can see that there are plenty of room for the nerves here at this level. Until you get down to the L5-S1 level, which is the level of her disc herniation, again you can see that there's white here, but there's this mass on the left side. Now anything on this side is left, anything on this side is the right. So on the left side, she has this significant mass on that really obliterates all the space in this tube. Remember, this tube is normally this big, right? And instead, all you see is this little bit of white right there. Okay, and that's the level of her disc herniation. This is what's causing her all her left leg pain and also causing her left leg weakness. The surgery that we're going to do is we're going to make a small bony window right here. And then as we come in here, we'll be able to just protect the nerve roots and get to this disc, herniated disc material. And you'll be able to see that during surgery. Recovery from usually after this type of surgery, patients are able to stand up and walk to the restroom the very same day. And a little later on in the day, they can, if they feel well, they can go home. Most of our patients prefer to stay overnight. But again, this can be outpatient surgery. She will most likely be able to drive within a week or two and then be able to return to work when she's comfortable.